Right, well, on the line we have Dr Tracie Miles, who is going to be chatting about Gynaelogical Awareness Month, which is the month of September. A very good morning, Tracie.
Good morning.
Sorry if the voice is a bit tinny. It's just that, as I say, it's all technological. I mean, when it comes to technology, oil and water, we just don't mix. Oh, and there goes the chair. Right, so tell us about Gynaelogical Awareness Month. What's it all about in the month of September?
Okay, so it's a really key month, the month of September, for women to start to think about looking after their health below their navel. We're all very, very good at being breast aware, and our charities in the breast cancer world really, really keep us looking and feeling what's underneath and around our bra straps. But we need to look below our navels. We need to remember that we also have a womb, we have ovaries, we have a vulva and vagina, and we have our cervixes, and we need to look after those too. So Gynae Cancer Awareness Month is a month where all the major charities get together, and there are a number of them in the UK, and we try to get women to promote their own health by looking out for signs and symptoms of gynae cancer.
Right, now, Gynaelogical Awareness Month, of course, is it a bit of a taboo subject as far as women's problems are concerned, a bit like testicular cancer in men?
Yeah, exactly. We don't like to think about what's down there. As I was saying, breast cancer is much easier. We sit on the beach and we get our boobs out, and we don't feel too scared about people talking about that part of anatomy. We start to talk about what women often refer to as their intimate anatomy, or the younger girls, their bits, and then we clam up. And we don't open up, and we don't go to our GPs to tell them about some very simple signs and symptoms that could actually lead to us being treated for very early signs of gynecological cancer.
Right, and of course it's a very important issue, isn't it, with women, because, with gynecological cancer, if it's caught early enough, the progress rate of actually curing gynecological cancer is greatly increased.
You're so right. And in fact, if all of our women from the age of 25 onwards in the UK, when we're invited to attend for our cervical smears, attended for those smears, we could make a massive difference to our health, and have early, very early, or even pre-cancerous changes detected in our cervixes, which would protect our futures, including our fertility. And even before that, if us mothers and fathers send our daughters to the GP to have their HPV vaccine. That's the vaccine to help stop one of the viruses that can cause be one of the causative features for cervix cancer. We could make a huge difference.
Now, of course, this Awareness Month goes through the month of September. So what events have you planned through the month of September to raise awareness of this problem?
Okay, well, there are lots of events going on all around the country. And as I say, we've got a number of charities in the UK. We've got 3 leading ovarian cancer charities. We've got Joe's Trust, who's the cervix cancer charity. And we've got the Eve Appeal. Now, the Eve Appeal are the pan-gynae cancer charity. So I'll give you one example. The Eve are doing Eve evenings. And essentially, that's where the Eve Appeal, you just have to go onto their website, put in Eve Appeal, and you'll find them. And you can set up an evening supported by the appeal where women can get together and just open up and talk. In that women it doesn't have to be a coffee evening. It can be, all sorts of things getting together. You might even find yourself in a pub or a wine bar. But where women can get together and talk and actually get rid of those taboos. So that's one of the many things that are happening around the country.
That's of course because, it is a taboo, and it's not spoken about enough as getting the message out to women. And of course it does affect families, doesn't it?
Well, absolutely. Cancer, whatever the cancer is, affects the whole family. You're quite right. And I think often the women often say, look, I just haven't got the time to go to the GP to talk about my symptoms. I don't want to worry my partner. I don't want to worry my husband. I don't want to worry my children. And so, yes, that needs to be broken down, that taboo, because it will affect the whole family. Anybody who has been through cancer in the family, whether they've had it themselves or has a family member, and that's about 1 in 3 of us now, which is a massive number, will tell you it's really, really devastating for all.
Now, of course, gynaelogical cancer, as you said before, like all cancers, it's people shy away from this sort of condition. Now, what would be your best advice if somebody is suffering from gynaelogical cancer, but they don't want to go to their GP? What can you offer as support and advice on that issue?
Okay, well, of course, the first thing I would tell them is I do want them to go to their GP, but let's say she's not going to, and that's not uncommon. Then there's always Dr. Google. The thing is Google is the world's biggest library, and it's not censored. So I would suggest that the woman goes to a website. I've mentioned the Eve Appeal, that's the pan-gynae website. I've mentioned Joe's Trust, that's the cervical cancer website. And then we have 3 superb ovary cancer charities. We have Overcome, Target Ovarian, and Ovarian Cancer Action. Tap that into Dr. Google and you'll get good bona fide advice from the charities that work in this country. So that's where I'd ask my patients to go.
Of course, it is all about looking for the advice and information, and there's lots of information and advice out there. It's just actually going to the right websites and, of course, to the right contacts.
Absolutely, and of course the other website that I haven't mentioned is the own NHS, the people that employ me, their website. I think that can also be a useful website. I find the patients tell me, the women that I care for and their daughters and their mothers and sisters actually prefer going to the charity websites, for example like Eve, because they're more friendly and they're less official looking. Going to the NHS website is a little bit like going to the GP online, if you get what I mean. So going to the charities, it's a bit more like talking to your girlfriend. But this girlfriend, that charity knows more.
Right, now, with it being September, and of course the Awareness Month, are you more busy during this month than throughout the year?
Do you know what will happen is, you're quite right, there will be a time lag of a couple of weeks, and in a couple of weeks' time I will have a lot more people coming into my clinic. That's a good thing. I would rather see people with something that isn't a gynae cancer dismiss it and move things on than miss that gynae cancer, as would the GP. And our GPs are superb. Let's not forget, they are really well trained at spotting the early signs of cancer, and if they're not sure, they will then talk to us in secondary care in the hospitals and refer the patient in.
Okay, now, you have a website, of course. What's the website?
So what I would like you all to think about doing is to go to the Eve Appeal, www.eveappeal.org.uk.
And of course, all the information is there. And again, it's just bringing women out and actually talking and hopefully finding solutions to gynaelogical cancer as early as possible. That's the key point, isn't it? Detecting as early as you can.
It really, really is, and I'll give you one really key example, because I've mentioned cervix a couple of times. Important to mention womb cancer. That is one that is often missed by a woman. Us women are used to bleeding through our lives, through our menstrual cycle, and the only time that stops is if we have a baby, and then it stops because we have menopause. And then if we bleed after that, because most of our lives we've been used to that, we don't bother to take that symptom to a doctor. That's one of the most obvious symptoms, early signs to take to a GP. Women who do that can be cured of early womb cancers.
Right, well, thank you for coming on to Ignition Radio and talking about Gynaelogical Awareness Month, and as I say, busy month, but it's getting the message out there, and it's a fantastic organisation. So thank you for coming on to Ignition Radio and talking about Gynaelogical Awareness Month, Tracie. Thank you.
It's a pleasure. Thank you, and thank you for looking after us and celebrating us women this morning.
Okay, take care, and thanks again.
Okay, bye-bye.
Bye-bye.
Bye.